So, Dr. Polsky,
Well,
you can't beat that. I'm sorry.
And I am
You're
not going to try.
upstaged.
That's a wonderful presentation to follow.
Yes.
Just wait for the slides to pop up. There we go. Okay, so Commissioner Hutchins, congratulations. And
Thank you very much,
it's
Doctor.
extremely well deserved.
Thank all of you.
So, good news pretty much all around, maybe with one toward the end this week. So our case counts, and we were not here last week, so the case count dropped the previous week and then dropped a little bit further this week. So 22 cases in the county, positivity rate of 2.3%, which is much lower than we've seen really ever. And if you take a look, again, in people 65 and over, we only had one case this previous week. A little bit of hedge there is that the number of people tested is a little bit less than half of what we were seeing a month or so ago. And that's probably for multiple reasons. One of which may be there's just less sick people to test, not just because less COVID, but less viruses in general as we move toward the summer. Some of it may be that for some people, they just feel like it's not as much of a threat anymore, and even if they're sick, they may not be going in to get tested. So it's a little bit difficult, as always, to say how many true cases we have in the county, but clearly, overall, we are very, very pleased. Statewide, still seeing at this point about 5 deaths per day, so 35 deaths over the past week statewide. And you take a look at hospitalizations, about 275 people hospitalized, 67 in ICUs, one of whom is in our ICU in our county. But again, those numbers are significantly lower than we were seeing several weeks ago and certainly a month or two ago. I'm not going to go through the chart, but just Calvert continues to rank 11th in terms of the number of people 18 and over having at least one vaccine. And we continue to rank second in the state in terms of the percentage of people 65 and over having been vaccinated, although we've really seen a stall in adults of all ages over the past couple weeks. We had a total of about 100 people countywide, 18 and over, get vaccinated for the first time this past week, that's a bit of a hedge, a bit of discouraging, and we'll get into the flip side of the numbers in just a moment. I will go back just for a second to note that when I gave our Board of Health presentation a couple weeks ago, I mentioned that year after year after year, Montgomery County and Howard County rank 1, 2 in terms of overall population health. So it should be no surprise to anyone that the two leaders in terms of the percentage of population being vaccinated are Howard County and Montgomery County. Howard County, 81% of everyone 18 and over has had at least one vaccine dose. And in Montgomery County, 77% of adults. In Calvert, that's 63%. So a significant difference in the counties. In terms of teens, since they are the newest kids on the block to be eligible, you can see that the biggest increase over the last week and a half have been in the 12 to 15-year-olds, and that shouldn't be a surprise since it was not until May where they became eligible. So if you break that into percentages, currently 32% of all 12 to 15-year-olds have had at least one dose. Very few have had a chance to get a second dose at this point. And 46% of 16 to 17-year-olds in the county have been vaccinated. So if you flip everything around, instead of how many have been vaccinated and take a look at how many haven't, or at least what percentage, you can see that we're doing great in 65 and older, although we would love to see that 10.3%, or those almost 1,500 seniors who haven't been vaccinated, begin their vaccination series. And when you look at adults overall, 37% of adults have yet to have a single dose. And when you take a look at all residents, since those under 12 are not eligible and we have lower rates at this point among teens, essentially half of the county have yet to get a single dose of vaccine. And the concern there is that either what they're starting to see in England over the last week or two, where the new variant in India has now come across into there. So even though they have a significant percentage of their population vaccinated, they're seeing a surge in cases. And if we end up seeing variants, or as we move into fall, into winter, there is a very large percentage of our population that is still vulnerable. So if this doesn't improve, we will see outbreaks again come fall and winter. It's just a question of how severe and how many people. So I will remind everyone, there are plenty of places to get vaccinated. The mass vaccination sites are closing. And it sort of seems to be ever changing. So I didn't put specific dates on there. Really, at this point, there's no reason for people to have to go out of county to a mass vac site. But if people do plan to go up to Six Flags or elsewhere, to check on the state vaccination website to make sure that that site is still taking people for first doses, because to further confuse, for some of those sites, they're now only providing second doses for people, and they're kind of wrapping things up. And then, once again, here's how people can register in county. A reminder that for many people, their local primary care providers are now offering vaccines in their office, so that's an additional option for most people in the county. That's what I have for this week.
Questions?
Yes, Dr. Polsky. You mentioned closing the 231 site here in the county.
So we have not made any definitive plans at this point.
Right.
My expectation at this time is that we will keep that open through the summer.
Okay.
And
My apologies then.
And then after that, we'll see how much demand there really is. And part of that is that, especially with college students, in many cases needing to be vaccinated prior to going on campus, my expectation is we're going to have people who wait till the last minute. So July, early August, we're going to have another influx. I want to make sure that everyone has access to vaccinations. We may cut back on the number of days we're there, because we have days, and again, 100 people countywide who got vaccinated last week, other than the teens, and most of them were when our nurses went out to the schools and vaccinated them in the schools. So there are days where we have 10 people show up an entire day to get vaccinated. And what we're looking at right now for our staff is ways to get out into the community. So, for instance, we've been talking to the management at Chesapeake Ranch Estates. Can we set up there at their clubhouse for certain days to have people in the community come out? So if we have staff sitting at the drive-through, essentially not doing much of anything, it makes a whole lot of sense to move them out in the community where hopefully they'll be much more productive.
Thank you.
And if we do get to the point where, well, I guess it's more when we get to the point when we no longer need the drive-through site, we will make sure there's a reasonable amount of advance notice.
All right, I think we're good, Dr. Polsky.
Great. All right.
Yeah.
Thank you all.
Thank you,
Yeah.
sir.
Thank you.